Good morning, Dr. Morgan. I've been reviewing some recent cases of post-traumatic stress disorder, PTSD, and I think it would be beneficial to discuss its definition, causes, and treatment approaches. Absolutely, Dr. Patel. To start, PTSD is a mental health condition that develops after an individual experiences or witnesses a traumatic event. It is characterized by symptoms such as intrusive thoughts, nightmares, emotional numbness, hypervigilance, and avoidance of trauma-related stimuli. Right. The DSM-5 defines PTSD as a disorder that occurs when someone is exposed to actual or threatened death, serious injury, or sexual violence. This exposure can happen in several ways: direct experience, witnessing the trauma, learning about a traumatic event affecting a loved one, or repeated exposure to distressing details of trauma, such as in first responders. The causes of PTSD are varied, but they all stem from exposure to trauma. Common causes include: 1. Combat and military exposure. Many veterans develop PTSD due to their experiences in war zones. 2. Physical or sexual assault survivors of rape, domestic violence, or physical abuse are at high risk. 3. Serious accidents, car crashes, workplace injuries, or other life-threatening incidents can trigger PTSD. 4. Natural disasters, earthquakes, hurricanes, or fires can leave survivors with lasting trauma. 5. Childhood abuse and neglect. Early exposure to abuse or neglect increases the risk of PTSD, often leading to complex PTSD. See PTSD. 6. Medical trauma, life-threatening illnesses, surgeries, or intensive care unit ICU stays can be traumatic. 7. Witnessing violence or death. This is especially common in first responders, police officers, and healthcare workers. That's a comprehensive list. It's also important to note that not everyone who experiences trauma develops PTSD. Some factors increase the likelihood, such as genetic predisposition, pre-existing mental health conditions, lack of social support, and repeated or prolonged trauma exposure. Exactly. And PTSD doesn't always develop immediately after the trauma. Some individuals experience delayed onset PTSD, where symptoms emerge months or even years later. That's why a thorough assessment is crucial. When diagnosing PTSD, I use structured clinical interviews along with screening tools like the PCL-5, PTSD checklist for DSM-5. But clinical judgment is key since PTSD symptoms often overlap with depression and anxiety disorders. Absolutely. In terms of treatment, a combination of therapy and medication tends to be the most effective. Trauma-focused cognitive behavioral therapy (TFCBT), prolonged exposure therapy, cognitive processing therapy (CPT), and eye movement desensitization and reprocessing (EMDR) are well-established approaches. And for pharmacological treatment, SSRIs like sertraline and paroxetine are FDA approved. I also consider prazosin for patients struggling with trauma-related nightmares. There's also growing interest in alternative treatments, such as MDMA-assisted therapy, stellate ganglion block injections, and even psychedelic-assisted therapy. Early research suggests promising results, especially for treatment-resistant PTSD. Yes, PTSD treatment is evolving, and we must stay updated on emerging therapies. A personalized approach is key since no single treatment works for everyone. Agreed. This has been a great discussion. Let's continue exploring new advancements in PTSD management. Absolutely. Let's catch up soon.